Welcome to TARTLEcast with your hosts Alexander McKegg and Jason Rigby, where humanity steps into the future and source data defines the path.
Jason, you can't handle the truth.
I can't.
You can't handle
I ordered the code red.
Yeah. The real question is, Jason, what does truth look like? That's a fundamentally strange question.
What does truth look like?
What does truth look like? I know what it looks
We talked about it yesterday on our Hard Density Living podcast.
Yeah. And I know that truth it's agnostic.
Right.
It's non-dogmatic. It's non-polarizing. It just is. Right? It's just something that it's just inherently, truth all the time. It just
It's a part of
exists.
creation. Yeah.
Right. So when we're looking at data when it comes to medicine, truth or evidence, there is not me, but all the individual health network systems do a pretty poor job of sharing patient outcomes. And a lot of that has to deal with the legal burden of trying to move medical information from one place to the next. That's just with HIPAA. You're trying to protect people's privacy. And with that, there was an article here that was talking about how there was a gentleman who wrote a book on almost like a pseudo surgery.
Right.
Where how you have like the placebo effect from, taking a pill.
Right.
During some FDA drug study. Well, they were talking about how when you do, when there's arthritis in someone's knee and they go to do the surgery, there's really no difference between actually going in and doing someone's, knee up. I don't know what the process is for fixing a knee, than actually just leaving it alone and telling them they had the surgery.
Yes.
They both actually have the same marginal benefit.
Yeah. Dr. Joe Dispenza, I don't know if you've heard of him or not. He does a lot of higher conscious type teachings and stuff like that, but he's always trying to bridge science with it.
Yeah.
He has a book called The Placebo Effect. And it's so interesting how we can persuade ourselves.
I think it was anywhere from like 40 to 70%.
Yes.
Have the
Isn't
same
that
effect,
crazy?
Which is wild with the strength of the mind. But not to sidetrack here, is that the general idea is that something that's going on with a doctor in Chicago to treat something is prescribing a separate drug than what, maybe a group of doctors are using in Boston.
Mm.
And a lot of those treatments and the outcomes of the patients, they're not shared between both of those different places. And someone may have a more effective treatment, in Boston than they do in Chicago or vice versa.
Right.
So when we look at that data, it's going to be important in the future that the availability of patient outcomes, their health, their healthcare records, and their behaviors are shared in between these healthcare network systems so that proper research can actually be done in an evidence-based manner that is non-dogmatic.
Right.
That actually has truthful information from an evidence-based observation of what's happened with those patients after they've gone through some sort of treatment.
Yeah, and they talk about politics getting involved, and I think and medicine itself, like it could be its own worst enemy, especially with these lobbyists and pharmaceutical companies and
politics. You think about the polarization of people wearing masks.
Mm-hmm.
Oh, you don't wear a mask? What are you, a Republican?
Right.
Or vice versa. But it has nothing to do with any sort of medical evidence. And we see that a lot. It's just like, oh, well, why is it that you're prescribing this drug? Well, just most of the prescribers in this area, this is what we dish out.
Right.
Well, do you know that it works? Well, I don't know. Well, have you checked any of the evidence in any of the other surrounding places that have chose to leave that drug? No. Well, that's the issue, is that there's so much siloed information,
mm-hmm.
and there's a lack of mobilization of the actual patient's identifiable healthcare information. And because of that, our research and our publications are lacking in a large body of evidence. And because we lack currently the targeted approach of taking all of that medical data and pooling it together and truly doing large body research on patient outcomes to give them the best quality of life and best quality of care, we're not doing that. But there is one way that can be done. So the way we've set things up on the TARTLE marketplace is that if you're looking to acquire medical information, you can get it from almost 85% of Americans.
Right.
And you have all the identifiable information on their medical histories, regardless if they went to a doctor in Chicago or Boston, it's all going to be there. And on top of that, you can encapsulate all their behaviors, whatever their diets are like, their emotional states, and you can capture all of that evidence-based information and you can get it directly from the individual. So rather than, have the red tape hold back our research and frankly delay it and decrease the availability of us increasing the quality of life through, more profound, critical, evidence-based research. Now you have the ability as a medical researcher, medical professional, or a biopharmaceutical company to go into the TARTLE marketplace and actually acquire that identifiable healthcare information from a specific person. And you can get it once, or you can continue to subscribe to the changes in their medical status over time. That's unheard of. But the benefit that is akin to what the article was talking about is the fact that if we're going to take an evidence-based approach, we need to have data. It needs to be shared effectively, right? And it has to be, completely agnostic, non-dogmatic, non-political. And that's the beauty about data. We can do that. Now you have the ability to capture that information outside of any politics and truly apply it to some good research.
Yeah, and I think that's probably the rub, I would think, here, especially here in the United States and pretty much world, with not just with the silos, but you have these good scientists, like these people that are really trying to hit COVID and hit it hard. And we have this opportunity as a world, as humanity, to come together over this pandemic and solve this problem. Humans have always been able to adapt and solve problems.
Yeah, we have. And now, TARTLE is a marketplace, not to spin us up, but it's an effective tool.
Right.
So we can actually come together and we can give those top quality researchers top quality data. That's what they need. And they can get huge amounts of it. There's no better way to solve this world's problems, to solve this pandemic and solve any future pandemics, than having a targeted direct focus and going directly to the individual, that source that is creating that data that can help solve that problem. One person may have the answer. We don't know, though, because we've never had an effective way of collecting all that information and using it effectively.
Yeah, it's so interesting. It's like you talked about in one of our previous episodes about the Spanish bringing those special type of clairvoyant people.
Oh, I like that.
Over
they had an increase in the amount of rods in their eyes.
And I would imagine, I mean, this is just my assumption, so we know what assuming me is, is there has to be somebody or a group of people that COVID doesn't affect.
Listen, think about it.
I mean, I'm not talking about the asymptomatic, but where they can't even get it.
Where they can't even get it, but we don't know that.
Right.
Because we've done a poor job of collecting information. We haven't had a proper tool to collect it.
Right.
And the mobilization of that data has never been there.
Yeah, and I could, like, just doing a study on asymptomatic people and looking at through TARTLE lens, saying, hey, did you have COVID? Did you test positive? Do you have a test results? Yes. Okay, were you asymptomatic? Yeah, I didn't even know. I just couldn't taste or smell.
Yeah, so if you are asymptomatic, like you
now let's do a study just on those people through the marketplace.
You can
the data that we've.
What's cool about this is that because TARTLE is a third party,
right?
We can bring people together with no political objective. What is the information you need? Great, we have something that allows the facilitation of you to acquire that information.
Yeah, because it has to be, I know there's theories on blood type or genome or sequencing and stuff like that. There has to be, I'm not talking about the anomaly side of things, but these asymptomatic people, I guarantee you there's things that they have in common.
Yeah. And
whether it is a blood type or high vitamin D levels, whatever it may be.
Whatever it may be. And we can objectively.
Yes.
Objectively.
Evidence-based.
Ask them in an evidence-based manner what is going on.
Yes.
Ask them all of those questions. Do your typical food survey study. Ask them about their behaviors. Ask them how they live their current life. And then to boot, buy their genetic information.
Right.
Okay. Buy their genome sequence and buy their medical record.
Yeah. Because I mean,
that's
I have
absolutely everything.
I have 23andMe and I went and downloaded my data on that.
Yeah.
I think I'm like 1.4 gigs.
Yeah, 1.4 gigs. And
It's me.
they give you a CSV file, right?
Yeah.
And here's all the raw genomic data.
Yeah.
That is some of the most valuable information. If you can see what's going on genetically and pair it with your behaviors
Yes.
for how you're doing something else, we are getting very close to solving a lot of problems for people.
Yeah, I know. And 23andMe, when I go on there all the time, and we've had a couple negative things that we've said with the.
Well, yeah, they sold all that data to GlaxoSmithKline.
Yeah, but they do ask questions like that. Heart disease, cancer. They're always asking medical questions on there.
That's only the thing is that's in a strange manner only benefiting 23andMe.
Yes.
We have this opened up so it can benefit everybody.
Yes.
Or the marketplace is agnostic. Anybody can use it, right? So if you're a researcher, that's where you want to go. You don't want to have to go beg at the front doorsteps of 23andMe for information, especially when it's not identifiable.
And also purchase it at a premium, I would imagine.
Yeah, they're going to mark it up. But now you can just cut them out of the picture and go right to the person that actually has that genomic data.
Yes.
That has that medical record, that has their behaviors, and have an interaction with them directly.
Yeah.
That's the future of research and science.
Yes. Yeah.
Is pooling all of our data together.
I love that. And let's close in this. And I want to ask something kind of fun, I think, and this will be a great question. So with DNA sequencing, and we're going to get scientific here.
Gattaca.
How do we, because I think this will be a fun one for everyone. Does our past lives of reincarnation,
that's interesting.
Does it,
would that affect
our spirit, our soul, or however, does that affect? I wonder.
We'd have to ask some people.
Yeah.
But all right. I'll take a wild stab. No.
Yeah.
I'm going to say
this
no.
individual meat suit.
Yeah. I'm going to, because if you think about how people describe reincarnation, if this is a new meat suit,
right,
then I guess the spirit body would have no effect on the genetic design.
Yeah. That's what I was thinking too, but I just thought I'd throw it out there.
I would assume that it would be agnostic.
Yeah. Yeah. That's what I would assume too. Yeah.
But what do we know?
Yeah, I mean, that would be interesting if it had just traits of...
We're peons. But maybe in the future when we have more sensitive when I say sensitive technology, we can, things that are more fine.
Right.
Like in sensors, maybe we can sense the energetic nature of a human being.
Yeah, and it'll be interesting to see when we upload ourselves to the cloud, especially our consciousness, when they figured that out. So then we can, and then be put into a new body.
That's crazy.
That will be...
What's that? What was that show?
It was on Amazon.
Altered Carbon.
Yeah, Altered Carbon, yeah.
And they had those like chips. And so essentially your consciousness is in this chip.
And then well-off people would have nice bodies. And
yeah, well, they had to have backups.
Yeah, backups, yeah.
Yeah.
In case something happened, then they could just...
That's wild.
They're back at it again. I would imagine that will happen in the future.
Nothing's new under the sun.
Mm-mm.
Actually, I think they said that in that article. But nothing new. There is nothing new under the sun, right? And given enough time, monkeys will be able to write Shakespeare.
Yes.
So, who knows?
You saw that. Have you seen the chimpanzee fishing?
No, but I was watching that video on the space race about the one we sent up actually here out of, whatever the Air Force Base here is in New Mexico.
Oh, Kirkland Air Force Base?
No, it's another one a little further south.
Oh, yeah, I know which one you're talking about.
That's where the chimpanzee
where White Sands is at.
Yeah, we launched that missile up into space, and we had that first chimp that went up there.
That's super cool.
I felt so bad for him because the doctors were like measuring his heart rate, and he was in like a panic.
Oh, really?
He was at like 200, beats per minute, and then once he actually got up into like low gravity, like microgravity, he was very calm.
Very calm.
Yeah,
oh, wow.
Little chimp.
Yeah, that's crazy.
Yeah, well, I forget what his name was.
And he survived?
Ham? I don't want to call him Ham or something like that.
But did he survive?
Yeah, he did.
Oh, that's awesome.
Yeah, he was cool. They trained him for 2 years or something like that.
So he was a little astronaut.
Think about the medical research that went into just training that chimp and make sure he was healthy.
Yeah, for 2 years.
Yeah.
Yeah, it's crazy.
That's wild.
Well, we better sayonara.
Yeah, I'm going into microgravity right now.
Thank you for listening to TARTLEcast with your hosts Alexander McKegg and Jason Rigby, where humanity steps into the future and source data defines the path. What's your data worth?